Hello, I'm Dr. Jayanthi Viswanathan, Senior Consultant Pediatrician at Rainbow Children's Hospital, Sholinganallur. Today we are going to discuss about breath holding spells in children. What is a breath holding spell? Following excessive crying, the child suddenly stops breathing briefly for a few seconds, and as a result the child will turn a little pale or limp or blue at times. This episode only lasts for a few seconds or less than a minute, but it is a very frightening experience for the onlookers. So, what typically happens during a breath holding spell? Typically, because the child stops breathing, the oxygen supply is cut off, and as a result of which these color changes happen. Breath holding spell commonly occurs in the age group of 6 months to 18 months of age, but having said that, we have even seen newborn babies or younger infants having breath holding spells. Breath holding spells can continue up to the age of 4 or 5 years, and after that it will completely resolve. So what triggers of a breath holding spell in children? You will find that the typical history is the child has either severe pain following a fall or injury that provokes the excessive crying, or it could be because of a temper tantrum. That is, for example, a toy or an object that the child was playing with may have been pulled away from the child, or it could be as a result of a frightening experience that the child has seen. Typically, what should be done as a first aid when a parent witnesses this breath holding spell? It is quite alarming or a frightening experience. Make sure when a child has a breath holding spell, you put the child flat on a safe surface so that the child does not get injured. You can put the child on your lap or put the child on the bed. Typically, do not shake the child. And if there is a wet cloth or a damp cloth, you can apply it on the face and forehead. Since the episode lasts for less than a minute and only for a few seconds, there is no major intervention needed. What should you do when a child experiences a breath holding spell for the first time? Please take the child to your pediatrician, because the child needs to be assessed by the pediatrician first, and typically with the history the pediatrician may be able to infer and find out whether it is a simple breath holding spell or something else. Most often we do not do investigations for breath holding spells. Most children are put on some iron supplementation, and this will prevent further episodes from occurring.